Senator Olympia Snowe, Republican of Maine, joins us tonight. Senator, you are now the only Republican, House or Senate, to vote for any of the health care reform bills that are out there. What do you know that your fellow Republicans don't?
Well, I think there are honest differences of opinion, but I do happen to believe that we have to move the process forward on this very difficult and challenging issue. Understandably, people do have honest philosophical differences, but I think there's a lot to build on with this legislation that, after all, was part of the group of six, 3 Democrats and 3 Republicans, for almost 4 months of very intensive discussions on a daily basis and on a weekly basis. So it clearly, I think, had built some momentum that makes it possible to construct a bipartisan package, hopefully.
The president went out of his way to praise your one vote. Does one Republican vote really signify any kind of true bipartisanship?
Well, obviously not sufficient. We need to have more. We need to have support of, Democratic centrists, for example, who also can play a very pivotal role in this regard. I think in building upon some of the issues and where we have to make significant improvements in this legislation. So I think that if we can work continuously together, looking at the issues, having an honest discussion about the issues and what works, what doesn't work. That's what it's going to take. I think for so long, the art of legislating has been lost here in Congress, and it's all about just moving it along on a fast track, and I think, unfortunately, the big issues have been set aside.
You said today your vote today was only your vote today, and it might not signify your vote tomorrow. What would cause you to pull back? What does that mean?
Well, that would mean significant costs are added to the bill or significant taxes. If some issues aren't addressed, such as affordability, we still have to work on that issue, making sure Americans have affordable health plans. They do under this legislation, but we need to do more and to be certain of that. And finally, of course, the public option. That is not an area that I have agreed to. I don't want government at the outset of the process that really could shut off the private sector. I think the private sector can do a lot because of the market reforms that we include in this legislation that will compel them to live up to a standard.
And just in a couple of seconds, John Carl said there is so much work yet to be done in reconciling House and Senate bills. Do you think we're closer to health care reform tonight than we were 24 hours ago?
Oh, absolutely. I think that it's at least demonstrating the art of the possible if everybody's willing to pull together and to work through the issues and not drive it through arbitrary timelines, which I've said initially as well when we began this process. I really do think we have to give the time that it deserves and it takes. It's what American people understand, and they'd feel better about it in the final analysis.
Senator Snowe, thanks for being with us.